to Lahori Roy, consultant gynecologist and laparoscopic surgeon practicing in Bhagirathi Neotia Hospital, Kolkata. Today we are going to talk about a very important complication of pregnancy and delivery. It is called as postpartum hemorrhage বা যেটাকে আমরা এমনি সাদা বাংলায় বললে ডেলিভারির পরবর্তীকালীন ব্লিডিং, excessive bleeding. Some amount of bleeding is expected during delivery and after that, but if it is excessive, what do we mean by excessive? If it is more than 500 ml in case of a vaginal delivery, or if it is more than 1 liter of blood in case of a cesarean section, we call it a postpartum hemorrhage. It is grossly of two types. Number one, which happens within the first 24 hours of delivery, called as primary postpartum hemorrhage, and another is that happens 24 hours after the delivery, which is known as secondary postpartum hemorrhage. Primary postpartum hemorrhage is generally very dangerous and should be acted upon immediately. Now, there are certain women who are at higher risk of having such increased bleeding. Who are those? Number one, those women who had a previous delivery where she has experienced postpartum hemorrhage. Number two, if she is anemic prior to delivery. Number three, if she has got multiple gestation, that means twins or triplets. Number four, if she has got high blood pressure, that may be pre-pregnancy, that may develop during pregnancy. And last but not the least, if she is on the higher side of weight, that is obese women. These women are always at a higher risk of developing postpartum hemorrhage. What are the main causes of this postpartum hemorrhage? If the uterus or the womb doesn't contract well after delivery. Number two, if there are certain written beads of the placenta inside the womb that will prevent the uterus from contracting and stopping the bleeding. Number three, if there is some tear or cuts in the lower neck of the womb, which we call as the cervix, or even down below, that is the vagina. And last but not the least, if the woman has got some undiagnosed or unidentified coagulation disorders or blood clotting disorders. So how will you know that you are suffering from postpartum hemorrhage? If you have very high pulse rate, if there is excessive bleeding per vagina, if you are experiencing shortness of breath, then you should immediately let the hospital authority know about the situation if you are still there in the hospital, or if it is after 24 hours, you should immediately get in touch with your doctor. Now comes how to treat it. There are various medications which can control the bleeding and take care of the uterine contraction. The faster we act on it, the more the chances that the patient will be well. You may need to get some blood transfusion done if the hemoglobin has dropped down below 7. That is given after cross-checking and hence safe. So don't worry, but always contact your doctor, and whatever the doctor says will help you save your life. Have a healthy pregnancy. Hope you get well soon. Thank you.